First of all, let me start by saying anyone in this room can fall. Anyone, including me, including Ann, including Rick. But people that are over 65 and older tend to have a greater risk of falling due to various factors that occur with the aging process. And we're going to examine some of these risk factors. And we're going to, some of them, not all of them. So, number one, unstable gait and posture is one factor. Gait is the pattern of how a person walks. And the most common one is stooping and a stiff posture. So that means that if you encounter an obstacle, it will get you off balance and you are less likely to be able to recover from falling because of that. The various causes for this condition could be arthritis, tendinitis, previous injuries that has occurred to you in your lifetime. Pardon? We're going to get to that next. Impaired vision. Have your eyes tested yearly and clean your glasses daily. How many of you do that? In fact, that reminds me, I got to clean mine. High or low blood pressure. Either one can make you dizzy and sometimes pass out. My own mom had low blood pressure and she fainted in the bathroom and she laid there overnight till the caregiver came and saw her. That was due to low blood pressure. Yep, overnight. Chronic illnesses such as Alzheimer's, Parkinson's, fibromyalgia, they can cause you to fall. Cardiovascular and neurological disorders, slow heart rate, irregular heart rhythm, or atrial fib as it's called. Neuropathy, which is nerve damage on your legs. Another factor is cognitive impairment, confusion, forgetfulness, reduction in mental functions, forgetting to take your medicine when you're supposed to. Taking strong medications. How many of you are taking more than 1 or 2 medications a day? Raise your hand. Any of you taking pain medicine? So you know they can be very strong. They can make you fuzzy. They can make you dizzy. Sleeping pills. Anybody taking sleeping pills? No one? That's incredible. Then they sleep well, they eat well, and they sleep well here. Yeah. So it speaks very highly for Casa Sandoval. Carelessness, tripping over things, right? Not looking where you're walking, where you're stepping. I think we've all done that. Here's another one. It's a very big one. Dehydration causes you to be dizzy, impairs your thought process, constipates you as well. Telling sign that you're dehydrated is a dry mouth. So you should drink at least 4 to 6 glasses of 8 ounces of non-caffeinated drinks, preferably water. Water is the best. People think coffee or tea is okay, but it still has caffeine. So it will dehydrate you. Not as bad as soft drinks, but still. Best thing, water. How many of you guys are drinking at least 4 to 6 glasses? That's a third of the room. What about the rest of you? You're not planning on drinking more water? No? Not interested? What if it tastes better? Juice? Juice is good. Yeah, milk is good, but water is still the best. Yep. How much a person should drink depends also on how hot the day is out there. Today is a pretty warm day. It's warmer than normal for April. I think it was 80, right? 80, 81. How active you might be if you're outside, you're doing a nice little walk and you're in the middle of the heat. So that can also dehydrate you. How many medicines you're taking. The more prescription drugs you're taking, the likelihood that you will have more dehydration. Another way of measuring if you're hydrated is how often you go to the bathroom to urinate. For some, maybe for you, it might not be much of a problem. I mean, maybe you're going too often. But 6 times over the course of 24 hours is considered normal.